long list of do's and don'ts to optimize egg quality. We measure egg quality by what is called ovarian reserve, so the only way to really assess egg quality is by actually doing an IVF cycle and judging ovarian response. You should eat healthy, you should exercise healthy, you should lead a good lifestyle. How can you improve egg quality? Obviously, the better the eggs, the better the embryos, and the better your chance of getting pregnant. That's a no-brainer. Everyone understands that. And that's why patients want a long list of do's and don'ts to optimize egg quality. And therefore, their doctors will send them to a nutritionist or will ask them to lose weight or to eat a healthy diet or not to take stress or whatever else. But the reality is there is very little correlation between any of these things and egg quality. We measure egg quality by what is called ovarian reserve, which you can measure either by doing a blood test called an AMH level or measuring a natural follicle count. Again, the problem with all these tests is these are static and doctors don't treat numbers, we treat patients. So the only way to really assess egg quality is by actually doing an IVF cycle and judging ovarian response. How many follicles grew? How many eggs were you managed to retrieve? How good were these eggs? Were they mature? How many fertilized? Now that's an expensive way to answer the question, I get that. And therefore, the advice we give for most IVF patients is pretty commonsensical, generic advice, which you honestly don't need an IVF doctor to give you. Of course, you should be the right body weight, you should eat healthy, you should exercise healthy, you should lead a good lifestyle. But honestly, that is all you can do. Because the amount of control which you have over your own eggs is very, very low. And the amount of control which the doctor has on your egg quality also is low. And the sooner you accept the truth, the better, because then you'll stop beating up on yourself first. Oh, I have poor egg quality because I'm too thin or I'm too fat or I'm too stressed out or whatever else. Just accept the fact that there are some things we can control and some things we can't.